What happens in a real-time ultrasound appointment? First of all, let's talk about what real-time ultrasound actually is. It's not the form of ultrasound that you may have experienced where it's being used from a treatment aspect, from the point of view of aiming to decrease swelling or apply heat to an area. It's a diagnostic form of ultrasound. So similar to when you might be imaging a baby in utero, our real-time ultrasound is looking not at babies, but at soft tissue structures. We're aiming to be able to see underneath the surface of the body and understand what's happening at the level of the muscles and soft tissue. What is a real-time ultrasound appointment? Real-time ultrasound is the diagnostic type of ultrasound. So it's different from ultrasound that you may have seen being used in treatment to decrease swelling or apply heat to an area. We're using real-time ultrasound to be able to diagnose and assess. It's similar to the ultrasound you may think of when you're trying to image a baby in utero. Although in our case, we're not looking for babies. We're looking at the way the soft tissue is forming and working underneath the surface. It's a fantastic tool and can be game-changing if you need that level of detail and learning and connection to your body to help your injury progress. Often we do real-time ultrasound for things such as being able to image a pelvic floor. It's fantastic to be able to see a pelvic floor lifting and lowering or not when a patient is aiming to do a pelvic floor recruitment activity. We can also use it for the deep muscles of the core to gain a better understanding alongside our patients. When we say connect your core, what's actually happening on a deeper level. And it can be fantastic for the patient to be able to visually see that in real time. It's such a great learning tool when they understand the feeling of what they're doing and they connect that feeling to visually what they can see happening on the screen. It can also be used for muscles of your deep neck flexors, your deep hip stabilizers, a lot of the deep core muscles in your body that are very hard to see from the outside and thus very difficult for a patient to learn without that visual feedback. A couple of important things will be told to you before your real-time ultrasound. If we are imaging core and pelvic floor regions, you might be instructed on how to use your bladder. So completely empty the bladder and then drinking 250 mils of water an hour before your appointment and holding it. We'll also give you instruction around the particular types of clothing you might want to wear. Because we do have to use the ultrasound gel, sometimes getting gel on your brand new fresh clothes is not the thing that everybody wants to do. But those instructions will be given to you by your therapist before your appointment.